Kairos Ryan and welcome to Teach Me in 20. Each week I'll release a new podcast where I get to speak with awesome people who have something new to teach me that I know nothing about. If, like me, you're naturally curious about everything, this could be the podcast for you. So come along for the ride. It'll only cost you 20 minutes. Hey guys, welcome to Teach Me in 20 with Kairos Ryan. Today we are joined by Madalena Grobbelaar. She is a clinical psychologist providing psychotherapy to adults grappling with numerous life issues, and her particular area of interest is in the area of sexuality, having completed her doctoral thesis in women's sexual difficulties. Madalena, thanks for coming along.
Pleasure.
It's awesome to have you here. It's a topic we don't often get to talk about, sex, and I'm sure you use that word many times in a day.
I do, yes.
So in layman's terms, how would you describe what you do as a clinical psychologist?
I think, a clinical psychologist obviously, focuses on the area of mental health, will look at a whole range of, difficulties, and that can be, a lot of depression, anxiety, some of the more severe spectrum disorders, such as, for example, bipolars, psychosis, all of that. But I tend to sort of I think what happened, and maybe should I just carry on?
Go for it.
No,
anything you say, everyone's going to be like, oh my gosh.
No pressure. No, I suppose in saying that, so I'm trained as a clinical psychologist, but as I did my doctorate in women's sexuality, that became an area of interest for me. Obviously, sexuality can't be divorced from any other aspect of psychological and emotional health. And so I think the clinical psychology background gives me the capacity to be able to see people within the context of their lives and whatever mental illness or difficulty they may have, which can often have an impact on their sexuality or vice versa.
Okay.
Yeah.
So I read up as well, your sort of your treatment is attachment therapy and object therapy.
Object relations.
Yes. So basically I tried to dumb it down and I read it's people's past influences their relationships and their sexual relationships.
Yes.
So what's an example of someone's past having an impact as an adult?
Well, I suppose, I think currently, of course, there's a huge focus on childhood sexual abuse and the sort of experiences that people go through. That often can have a profound impact on somebody's idea of who they are as a sexual being, how they relate to a sexual relationship or a sexual interaction, issues around their own identity in adolescence, issues around who they're attracted to. Individuals are so diverse that I think there's a whole range of things that can impact sexuality, childbirth, too much work, stress, illness, loss, grief, all of that can have an impact on sexuality. In fact, I think one of the biggest misconceptions is the idea that you sort of, you travel along your life, you go along and this happens and there's loss, whatever, and you're going to remain always the same sexual person. Well, I think that's there's a myth around sexuality. It's always impacted.
Which I don't think people sort of think about, how their emotions are affecting them, not only with people but with their own sexual life. I guess, would you say lifestyle or relationship with themselves?
Yes. I think maybe sex has been so taboo for so long. It's imbued with, values and norms and gender roles and all of that. I suppose that many people have an erroneous expectation that, that they might have just been fired or, they've just lost somebody, but they're still going to be fine sexually. Their desire is not going to be impacted, or it's okay, I've just lost my job, but it's okay, I can have sex. It is a myth, I think, and I find that a lot of people that I work with that will come in will have that sort of myth around sex, that it won't be impacted.
So what's a common, and this could be very broad, but say a couple comes in. What's probably the most common, I want to say problem, but I mean, it's just a difficulty, I guess, as well, that you see over your years of work?
I'd say I'd say that the two most common ones, I think, is low sexual desire. Mm-hmm. And again, I think that there's a media hype, and there was a lot of, and that's a different topic of research debate, but around women having low sexual desire, I actually tend to see both men and women with low sexual desire. So, I was going to say, is it, I mean, and it's gender stereotyping here. Hugely.
I'm just sort of wanting to put out the question, is it men more coming to you with a problem, unhappy with the sexual relationship, or is it the female?
I think it depends. It depends on the context. So within the two sort of, there's many broad presentations, but let's call it the two difficulties that I might see more of: low sexual desire, and also desire discrepancy, or discrepancies in how much people want sex. Mm-hmm. And that's where there seems to be a little bit of an argument between couples. Now, that could be both male or female. Now, I'm just talking now about heterosexual relationships, and I probably will focus a little bit more on heterosexual now as I talk to you. But the same applies in other, sexual orientations. But it is low sexual desire and desire discrepancies. Would it be more male or female? Not that I'm aware of. Okay. I think there's a hype around that. There's a huge media hype and a gender stereotype. But I don't know that I would say that one is more than the other. Yep. And if it is, it's because we've had a model of sexuality that's been, in a way, socially constructed, that men should desire sex more often than women. And that becomes a difficulty.
And that goes back to we've been brought up thinking a certain way, and that impacts our adult relationships.
Yes.
I mean, we just touched on it then. So I've got a few gay friends, and they, often, so females like, oh, it'd just be so much easier dating a guy. Do you see, obviously you deal with same-sex couple relationships?
Yes.
I mean, what are the varying, what are the differences in problems for them? Or is it very much similar?
I think it's very much similar. You see, I suppose that it depends. If one is going to assess problems based just on behavior, how we have sex, in what manner, and in behavior, then there may be differences along the way. But I don't see sexual problems as divorced from any other part of who we are.
No one's immune then.
Well, I don't think so, because I think that, we are embodied creatures. We are sexual. We are. And so, again, there's no such thing as your penis doing one thing and your vulva the other, and you somewhere else. I mean, it's everything is part of who we are.
Yep.
So I don't know. I mean, some people may have a different opinion. I find that problems and difficulties are very much the same and related.
Yep. Yeah. What's probably one reoccurring piece of advice you find yourself giving to couples?
I think probably the most common one would be around the idea that, the sexual experience, people's sexual experience, their sexual relationship, their whatever sexual interaction is actually unique. And we've been socialized, I think, and we still are, although, things are changing a little bit, but we're still very much socialized within a model of how we should be doing sex or how we should be sexually.
Okay.
And this model has historically been very male-dominated. One of the things that I find that I work with a lot of both males and females is the idea of a penile-vaginal model of sex. In other words, you have to have penis and vagina sex as the top of the hierarchy of sex.
Okay.
And all other behaviors are not known as sex.
Right.
They're all foreplay, or they fiddling around, or, touchy-touchy, whatever it might be. And that's, I think, probably one of the biggest problems for couples or for individuals that I see. Because sexual interactions and sexual behavior, I think, should follow more horizontal level. You don't have to have penile vaginal penetration or whatever it might be. I'm talking about penetration of whatever sort. There's so much more that one can do to be sexual. And so we've got a very restricted model, which I think is very male-based.
So you're basically saying it all should be counted and all should be sort of validated as still contact and contributing to a healthy relationship.
Oh, absolutely. And I think that we know, for example, historically, that for women, for example, there tends to be a lot more pleasure involved with, clitoral stimulation per se without penetration than And that isn't, it's more talked about now, or it's more discussed, but there's still this idea that I should be having sort of penile vaginal penetration as, the top of the, what do you call it? The
pyramid? Hierarchy?
Or the cherry. That's what I want to say.
Hierarchy of sex, we can call it that. I think we've just come up with a new doctorate.
Or the cherry on the cake or top or whatever it is.
On the sundae.
Yeah.
I guess, so I asked around a lot in preparation for this interview, and I did a bit of research, and a common occurring thing seems to be the norm of what is it normal to do this, etc.
Yes.
And insert any question here.
Yes.
And there's things where girls, I can't come. I can only orgasm out not through, as you say, penetration, but other stuff.
Yes.
Or guys don't want this act performed on them. And is it normal? And I guess is half your job basically explaining to people there's no norm.
Yes.
There is no normal sexual relationship.
Yes. That's a very important observation. I think a really important one. It is half of my job is to try and I suppose normalize the idea that the way you're having sex, as long as it's consensual and, the way you're having it doesn't matter. And that's, I think, what comes down to the sort of a model, the construction of how we should be doing sex and what behaviors should be part of sex as such. So, if you... And I think also what you look like. I think that's another big thing along the gender lines. What do my genitals look like? Am I normal in that way?
Right.
That also taps into the idea of being normal, and that's a very, very, I think, a huge concern in our society, particularly when we're doing sex, because I think it's a very vulnerable state to be in. To, undress, be naked. For many people, it's very. It feels very vulnerable, that sort of experience. And there's a lot of expectations around how we are, Am I good at sex? Well,
Let your partner be the judge.
Yeah,
if they're happy,
And number one, yes. And number two, it's an exploration. I think Esther Perel, she's a couples therapist. She talks about the fact that when you have sex, it's a place you go to. It's not really... It's not so much about what you do, but it's a place you go to in your mind and body that determines the experience,
Sticking with the couple theme at the moment, I did want to also talk about the individual aspect. And again, doing a bit of research, and a lot of women after childbirth, they lose a lot of sexual drive. They find their husband repulsive. And that's something that's not really talked about.
No.
And is that something you see a lot of? And is there a lot of shame from women in that?
Yes. I think there's... I think there's shame. I think that we're living in a very objectifying society. Women have always sort of been objects to be looked at. I think the other thing that becomes quite tricky for women is that I suppose those same pleasure points of women's bodies, breasts, genitals, vulva, vagina, all of those, and so many more, those become in a way, they perform a different role when it comes to having a child. You can have a woman who has a baby suckling on her breasts in the morning and a husband who wants to suckle at night in part of. Now, that boundary, to traverse that, I think is incredibly difficult.
Okay.
And so I think there's a lot of that I think there's a lot more written about that nowadays. But I suppose that there's an expectation for women to be very flexible in how they perform those roles. And there has to be, I think, women need to be able to process certain experiences in order to be able to, navigate their role and then find their desire again or whatever. Desires, it's not something that you have and then you don't have. I mean, it's fluid constantly, you know.
Well, in that situation though as well, I mean, here's a man who obviously just wants to be with his wife or partner, and they could maybe be getting the retaliation on it. You sort of feel for both sides in that this is a man who just wants to be with his wife. And how does a guy from that angle deal with something like that?
I think it's a really good question. I see that potentially one of the problems is that I think we still, from this model that I talk about in sexuality, is that there's more focus, I think, in our cultural upbringing of males that doesn't allow, or that still looks at masculinity as being very performance-based, as being very sexually oriented, as being, if she's not having sex with me, does it mean she loves the baby more than me? And what must I do? I think that if we had to, allow our males from childhood and to certainly have more flexibility in the way that they relate to intimate partners, be it male or female, or, I think that will allow them different avenues to be able to experience their relationship with their partner.
I was going to ask as well, do you think there needs to be more done from an earlier age in terms of education?
Yes.
I went through Catholic schooling, and sex ed is very limited in what they teach you based on the religion. But not even from a sexual education perspective, more just as a personal, for someone trying to figure out their sexual orientation. Do you think that needs to be done, whether that's in schools or programs outside of school?
Yes.
For people to learn.
I think so. I think that there's lots of people doing wonderful stuff. I think that one of the things that I realized when I sort of did my research is, it seemed to me that one of the things, and maybe I'm basing it on my experience and not on anybody else's, but the idea that a lot of women, because women tend to be the primary socializers in the home, there's still a lot of shame around women's sexuality, and then women tend to develop, certainly who I've spoken to, they tend to become more comfortable with their sexuality as the years progress. One of the problems is, though, when they're socializing their children, they may still be at a time in their lives where they're still not that comfortable.
Right.
And it feels to me that we absorb, or what we call internalize, a lot of these restrictions and ideas about sexuality through our parents that are very, I think, in unconscious ways. And so women, I'm not saying women per se, but men as well, but children are still absorbing a lot of their parents' hang-ups around sexuality. So it's not only, I think, the school system, but I think sometimes in it, not intentionally at all, but we absorb the stuff, and children are, do that very young.
Yeah.
So I think all that discomfort with sex, that confusion about sex, those things that I think a lot of people, most of us go through as we're experimenting or trying to find ourselves sexually, some of that can maybe be, I suppose children pick up on it.
Yep.
Yeah.
Learned behaviour or learn sort of interaction with opposite sex.
I think certainly more, internalize the same way that we internalize parents, the ideas about discipline or, cleanliness or whatever.
Yep.
That seems to happen.
I wanted to ask as well, what is something, in terms of a couples or even an individual, what's something that stumped you? So in a session, you've just gone, wow, school, just none amount of study prepared me for this.
It's interesting. I don't know that I can. I think one of the things that I don't know that I can answer that with something that stumped me.
Or surprised, or
I think I'm just more surprised with I think more of the rigidity of what people hold on to in terms of their gender norms.
Okay.
I'm more surprised by that. I think once you begin to see sex and sexual desire along a continuum, then whatever people do, and again, of course, there's behaviors that are like seriously maybe weird.
Like fetishes or...
Yeah. And, there's a number of them that I think we still think are weird in a society. But, historically, it could be that in 100 years we don't. I mean, there's such a variety. So I don't know if I can answer that. I'm more, I think, surprised by how rigid we hold on to our expectations, assumptions, the things that we feel quite secure in.
Yeah.
Because there's still very much there's still a lot of anxiety around sex and what it means and who I am as a sexual being. How am I going to be experienced? How am I going to be valued, judged? All of that. I'm more surprised by that, I think, than an actual behavior.
Yeah.
We all find, it's like our taste in food.
Yeah.
Some people have weird compared to what I think. Yeah. But,
So with the whole idea of therapy as well, often people think, if you're going to, couples counselling or something, that's the last straw. I wanted to ask, is it, or can you go to therapy as more of a cathartic thing and just to talk about your relationship and get things off the table that you may not be able to do in your own house?
Oh, absolutely. I think that's spot on. I think there's a range of things. I think, again, it's maybe just a misperception that you go to therapy because you've got serious problems. I think there's a whole range of things you can do. Yes, some people sometimes need help with a voice. They want to be able to voice some of their opinions. They need a bit of support. Sometimes there's relationships that are breaking down that actually need guidance on how to break down.
So how to, they need a breakdown and then sort of rebuild?
No,
or
it could be that people are ending,
Okay.
that they come to counselling and some of the work is around assisting them in, dissolving their relationship or, in a way that's maybe healthier, more amicable.
Can you tell a relationship from the beginning that, okay, this is helping them resolve or it's helping them depart from each other?
It depends. Sometimes I might work with, and I have had experiences where I might work with some couples for a few sessions and they come to the realization that either one party isn't really committed to stay and that can come out. Sometimes I might work with them for much longer, a year or whatever, and then they come to that So
is there anyone you just haven't been able to help? Like, in comparison, say people come and try and learn tennis and,
Yes.
there's students where you can tell them to change your stroke, you need to do this, and they just don't want to listen and that you can't get through to them. Are there any examples of that where you've just gone, well, I can't help you then if you're not willing to change this behaviour or listen to your partner?
That's I suppose that's a really tricky question and I don't know, in my experience, I think most people would like to and want to change. I think the barriers to change are many. And I think, again, I want to bring in the word anxiety. I think there's a lot of anxiety around how we change and if we can change. And I think people are scared of change.
Yeah, sure.
So as much as they want to change, sometimes the change feels too hard. Sometimes it feels too dangerous at some level or, I don't know. Of course, there's been people that I can't help or people that haven't been helped, for such a number of reasons. But I do think that people try very hard. And they usually, in my experience, they usually come in with wanting to change. But it's a very difficult thing,
Yeah, absolutely.
Which is why I suppose that in psychology, the idea of telling people what to do is useless. It's not going to get you anywhere in the sense that people know what to do. I mean, they don't need a psychologist for that. They need a psychologist, I suppose, or somebody to support them in their experience of how they're going to about bringing change or changing their relationship or their attitude or whatever it might be.
Yeah. So you're sort of trying to bring out their own realisation of what needs to be done?
Absolutely.
Yeah,
yes, absolutely. And, I think the most important thing is to be able to, I tend to work with people more long-term because I come from a way of thinking where the relationship is important. So we develop a relationship, with clients, and we hope that within this environment that that's going to make it more conducive for change, whatever variables, are there.
Just as well in terms of individuals that may come to you. And you mentioned specialising in women's sexual difficulties. Say a woman has come to you and she's in an abusive relationship.
Yes.
Do you have to report that, or is it all confidential in your sessions?
Well, it will depend on the sort of context. I mean, that is a very tricky area. Mm-hmm. I don't tend to, if I'm seeing the woman on her own, then I will let the woman guide me in where she's at. I mean, the number one thing in anybody who's in an abusive relationship is going to be safety. Yeah. So that's going to be my first concern. I suppose that, we've got rules and regulations that we need to practice within. But I think that really what's important is for us to listen to what the client brings in. I don't know that it would be, I would never go and report something without, without the clients. I mean, that's obviously touches our confidentiality. So I think the work is tricky around that.
Definitely.
And I might work, depending on the situation. There's so many different situations when it comes to abusive relationships, but I might work with some organizations for added support, extra support, a more multidisciplinary approach in those circumstances.
I wanted to ask as well, and I know you're trained in this, but how, especially as a female, if you hear something like that, how do you keep your own personal bias out of a situation? Even if you saw a couple come in and you can just see, it doesn't even have to be the female being sort of, I guess, antagonized, even if a male. How do you, I guess it's just human as well, you just feel for people.
Yes.
How do you not let it affect you, and how do you keep your personal bias out of your work?
Well, I suppose, it's one of the things that I'm always saying to my students. I don't believe that we can be non-judgmental. Okay. I mean, I think at least I'm judgmental. I mean, I am. I don't know how you can not be.
I mean,
like
I'm
that.
Trying my best.
Yes, and we do try. I don't know that the idea is to be not, to not have a bias. Yeah. I think it's important, and I suppose again, it's the way that we do therapy, the school of therapy that we come from. You need to put things into place so that whatever's being evoked in you at that minute. Mm-hmm. Because often it's about both what's being evoked there, but what's going on for me as well. I've got my own history, whatever. Yep. So I need to take that to a place, and usually it will be through my supervision. So I have, I say to my students, you cannot do this work because you're interacting with people at very, very vulnerable levels, very intimate levels. I think it's important that you always have your own relationships, your supervisory relationships, colleagues, peer supervision, where you go to and you say, hey, this is what happened. I felt pulled into this one, or I felt more pulled by her, or, by him, or whatever the case might be.
Yep.
Yeah.
When, as well, Madalena says her students, she also lectures at high level, some very esteemed universities in Perth. So she's also got that hat she wears as well. I wanted to ask as well, Mads, what does a healthy sexual relationship look like to you? And that is probably a tough question.
Good question. A healthy sexual relationship. Well, I think where people make allowances for the fact that you have really good sex, you have sort of arbitrary sex, sometimes it's downright yucky sex. Maybe not yucky, but not so good.
We've all been there.
Yeah. So, I think a healthy sexual relationship is where partners are able to have the freedom to say yes and have the freedom to say no. Okay, that's really important. To be able to say no without the expectations, is my partner going to feel rejected, feel that I don't love them, et cetera, and in turn, that they are able to sort of feel that as well, to be able to reach out for sex, to understand that sex is part and parcel of their relationship. It comes, sometimes there's a focus on it, sometimes there isn't. to have really realistic ideas. You know, if you haven't slept for 18 hours and you're really tired and you're overworked, I don't know that the first thing you want is to have sex when you go to bed at midnight. So those sort of expectations, I suppose, yes. And to be able to have, again, a space. I come to this idea of a space where you can joke sometimes, a space which is intense sometimes, a space which is, creative, whatever it is. I think that's healthy.
Yeah, absolutely. And I think it's that back to that point of the expectation versus reality and making sure you're both on the same page and
yes,
maybe sort of dumbing down the expectations and also your idea of the perfect reality.
Absolutely. I don't think that there's sex is actually quite, if you think about it, quite cumbersome. We get into weird positions. It's got, there's some weird things about sex. There's smells and noises and, feelings and all of that. So I think also, again, I talk about the freedom to be able to, keep it in flow, not to, I don't feel I'm being articulate, but I suppose to just have less expectations about what it's supposed to be,
That, yeah, and I think you articulated it. Sex is just, it's not a topic discussed a lot. And I think if we can, especially with younger people, if we can just put it out there as less as a taboo subject and more just transparent and more better education, I think
yes,
you especially would see less individuals grappling with issues and leading that into their adult relationships as well.
Yeah, I suppose one thing I haven't said, and I think, again, something that I think is important about sex is that whilst there's been so much focus on sex as a behavior and what we do, there's really been less focus on the meaning-making around sex. What does sex mean to people? Okay. I think that's a really important question to think about, because a behavior is a behavior, but meaning-making, that's what our life is about, whether it be sex or jobs or children or, we need to find meaning in our lives. And sex, we need to know what the meaning is for us.
I wanted to ask with that meaning as well, do you ever have couples that abstain and did no sex before marriage?
Yes.
And then they've come to you and basically are like, well, it wasn't what I was expecting.
Yes.
Do you, and not to put you on the spot, but do you think sex should be encountered before they commit a lifelong commitment?
Well, that's a moral question. I can't.
I guess I'm more like, do we test the wheels before we buy the car? And
again,
or is it? I guess that's a religious thing as well, where it's the things that it's, as you said, it's sex. It just encompasses a relationship. But if people have sort of waited, they have this massive expectation. And the reality, the first time, I guess, that's another thing I wanted to ask. Do you see a lot of couples that have abstained?
I don't see a lot, but I certainly have seen.
Yeah.
Yes, and I think there is expectations. One can argue maybe more than others, but I don't know, because I think that all of us have expectations as well about an ideal love. It's an ideal. Whether you abstain or not, all of us come into relationships, I think, with ideals. And every ideal is going to somehow be disappointing, because it's an ideal.
Yeah.
And we're human and we've got flaws. And so I think that is to do with people's morals. And I think rather I need to listen to what they're bringing in, and I need to listen to where it is that they're having difficulty, what it is that they're having difficulty in accepting around the certain way of having sex or the frequency or, whatever.
I think you just answered. I was going to say, if you could tell everyone in the world one thing about sex, what would it be?
Gosh. I think it would just be around that sex is as variable as each individual. We are uniquely sexually different from one individual to the next. And that whatever experience or desire, it's our own. I think it's important that we learn to, accept it as part of who we are. But it is uniquely our own, and there's no such thing as real sex or perfect sex or ideal sex or
Yeah.
it's what we
Contrary to what the movies make out.
Yes, exactly. Yes. That's
All those heartthrobs messing with our brains growing up.
Yes, that sort of sex made in heaven when both of you orgasm and the drums are beating and.
Or guys when they watch porn and it's just like, this isn't how it always is. Like, this is not a typical female.
Yes.
Yeah. Okay. Fantastic. Madalena, thank you so much for sharing with us today. It's, as I said, it's not a topic discussed a lot, and this is all about what this podcast is and just learning, and I'm sure you've taught everyone something here today.
Oh, I hope so. Thank you, Karis. It's been great.
See you guys.
Bye.
Thanks for listening. I hope you enjoyed that episode of Teach Me in 20. If you did, and if you even just learnt one thing, make sure you subscribe so each week you can learn something new with me. Bye.